Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got some great basic movement pattern exercises to help reduce the stress that's aggravating your lower back degenerative disc disease. Hope you enjoy. So let's keep in mind with degenerative disc disease of the lower back, flexion, which is bending forward, by far is the most aggravating motion to most people with degenerative discs. And it makes sense. The discs are on the front or anterior aspect of the spine, and as we bend over, sometimes even just a little bit to brush our teeth or to wash at the sink, that flexion component compresses the disc. And with disc degeneration, the disc is not up to its normal stress-bearing capacity, and that many times will aggravate our pain. So learning how to bend forward, whether we're exercising or whether we're just moving during the day, is a key component. And many of my patients that receive great chiropractic care for degenerative disc disease will aggravate their problems if they're not keeping in mind these three basic motor patterns or movement styles in order to bend forward during the day to do things. We all have to tie our shoes, we have to bend over to pick things up. Learning how to do so is essential. So let's go over these three patterns, which all emphasize the bending motion being centered at the hip joint, where the leg meets the pelvis, as opposed to bending from the lower back. Before you bend down for anything, it's important to keep your RPI, or reverse posture isometric, targeted to your unique spinal stability. In every spinal condition, there's a particular neutral spine position or safe zone of movement and body position based on your unique mechanics and body posture. We have this outlined at the painfreeandfit.com website, where you can take a free body analysis to determine what unique posture problems you have, whether you have a tendency to lean to one side with your torso, twist with your pelvis or torso, have a weak transverse abdominis, an abnormal functioning internal or external oblique muscle, a dominant latissimus or lat muscle on one side, an abnormal functioning multifidus. These various back muscles and your posture issues will all support an asymmetrical stress on your degenerative discs that need to be taken into account before we bend or exercise or move in any way. So that's unique for each and every individual person. Go to the website, get the free body analysis, learn what your unique posture is. We also have that in our degenerative disc program, the Fast Track program, at the painfreeandfit.com website. Once you have your neutral spine engaged, the three basic ways of bending forward are to, number one, squat to get down to where you want. That's keeping my spine neutral without moving it at all, making the motion come from my hips. Is also lunging is another way to get down. Again, you'll notice my hip motion or a split squat motion where I'm not bending my spine. If I need to get deeper, I can further tilt from my pelvis to get to where I'm going. Again, keeping my back flat, not bending or flexing forward on it. And the last motion is called the straight-legged deadlift, where we have a slight bend of the knee, and again, I'm rotating forward to bend what I'm to pick up. No motion coming from the back, all in the hip. Either of these can be done with holding on for a little bit of balance if you don't have your balance yet trained with your healing exercise program. We're going to go through each one of these real quick and outline some of the mistakes with them that people make to avoid aggravating your degenerative discs. Number one, with the squat, as we squat, many people will have a tendency to hip hike on one side, which compresses the lower back. That's usually associated with the rib cage leaning down on that side and the leg that externally rotates. We all have a tendency to stand or to walk with one leg turning out. We have a favorite side that turns out. That side typically creates a mechanical habit in the body where the hip comes up and the ribs lean down. So make sure when you are squatting, your hips and your lower ribs are level and we don't have hip hiking or leaning to one side. Another problem with squatting is as we squat down, many people will have a tendency to put their knees forward as opposed to bringing the hips back. That limits the amount of hip motion that you can get in and puts undue stress on the knees. So make sure that as you maintain 4-point balance on the feet, you're moving your buttocks back enough to allow your feet to be balanced and the motion coming from your hip joint. A lot of people with degenerative disc disease also have an anterior hip glide, where the hip has a tendency, due to tight muscles in the hip flexors and weak glute max or buttock muscles, to have the hips slide forward in the socket. And what that does is it puts excess pressure on the hip flexors, which can complicate lower back mechanics. So to correct that, make sure that the side of your upper leg bones where they attach in your hip sockets are moving back in the hip sockets as you squat. Remember that all of these components with squatting are based on making sure you have a neutral spine first. So you're not going to lose that. You're going to put your spine into a neutral position or RPI tension and correction, and then maintain that as you're bending as you squat. The next movement we have is a lunge or a split squat. The typical mistakes with that is that on the forward leg, people have a tendency to hip hike or raise the hip upwards and to lean the ribs down as we're bending to get something. So make sure that on that front leg, you're creating some downwards pressure with the hip. That creates a level pelvis, and make sure you don't lean into that side with your torso, but keep the rib cage up on that side so you have a level lower rib cage and hips as you come down to reach for whatever you're getting. Many times in this position also, people that pronate with their feet have a tendency to lean more on their inner edge of the heel, will cause a disturbance where the knee joint pulls in. As the knee moves in and the inner edge of the foot collapses, the whole pelvis would have a tendency to torque forward. That puts pressure on degenerative disc. So make sure that your foot is balanced on all four corners and your knee is directly above your foot as you lunge. The last option we have is moving from a straight-legged deadlift, where we come forward. This again takes a lot of hip strength, which is central to a lot of lower back problems. Where we have weak hips, we generally have more stress in the lower back. So there are several exercises in our degenerative disc program that emphasize this anti-hip hiking or hip motion that can really help to strengthen your hips and stay away from lower back stress. But typically what we want to do is as we bend forward, we keep a slight bend to the knee, our neutral spine position, remember engaging all those muscles that we learned about our unique RPI or neutral spine position. And as we rotate forward, we're going to have the whole pelvis and the upper body roll forward on the hip joint. So again, from my head to my tailbone, I have a straight line. There's no motion in my lower back bending forward, but all the motion comes from the hip, and I can come down to pick something up. As I go on, if I need balance, help with that, I'm making sure that as I go down, again, that front leg is not hip hiking, my rib cage is not leaning in. And the other mistake with this is many people on one leg will have a tendency to have their pelvis turn away from that leg. The pubic bone will turn away. Many times if that's associated with twisting the lower back, that's going to aggravate our degenerative disc. So we want to make sure that we hold our pubic bone inward so that the pelvis is straight as we bend forward, avoiding any hip hiking or rib leaning on that side. Sometimes you're looking to get lower down to reach something. With flexibility and continued training, you'll get greater motion to be able to get down all the way. Back is totally flat, and all the motion comes from my hips and buttocks. Keeping these tips in mind, practicing them, using them in your daily activities, helps to prevent that excessive flexion on your lower back discs, helps to prevent degenerative disc problems. If you want to learn some more exercises of how to strengthen these muscles to help you do these movements, check out our Fast Track program for degenerative disc disease available at the painfreeandfit.com website. Any questions or comments, write in. I'd be delighted to try to answer them for you. If you like what we're doing here and want to help me help others with this vital information, give me a thumbs up below. Subscribe to our channel. We got a lot of great exercises for degenerative disc and lower back problems. I hope these basic motor patterns help you with your lower back degenerative disc disease.